Well, good afternoon. People, I think, will continue coming in. There's still a fair number of people milling about in the hall, but I want to welcome the group to our next session, which is essentially an afternoon with us, whether or not you want to call us experts, but people in this field who've been in the field for a long period of time who are going to share information with you. Again, this is really focused at early career professionals who are nearing the end of training or just begun training or have only been in the practice of medicine after training for a few years and are desirous of sort of hearing our summaries on a variety of topics. The agenda is I will begin with a short overview of benign urologic conditions, and I'm really going to focus more on career aspects for me and how I became a urologist. That will be followed by Lori Berder, who will speak at 2:15 on essentially translational medicine going from the bench to the bedside. Next at 14:30, Francisco Cruz will speak about pelvic pain and biomarkers. At 14:45, Enrico Finanziagro will speak about urodynamics. At 1500, Dr. Kuo had a family emergency and was not able to come from Taiwan, so Dr. Zhang will be presenting Dr. Kuo's talk on novel treatments and approaches to benign urologic conditions. And then finally, we finish off with the famous and not to be matched Coral Eric Anderson at 15:30, who will talk. At 15:15, who will talk about the science of pharmacology as it pertains to our field. First and foremost, you're entering or are in a field that many of us love. I mean, functional urology is really, I think, an exciting part of urology and pelvic floor medicine. It is there's tremendous discoveries being made now more than ever. I want to credit Francisco and Coral Eric and Lori for some of the basic science work that has really elaborated our understanding of lower urinary tract afferent function, as well as receptor issues within the bladder and the urothelium. For instance, Lori is doing some very fascinating work on some newly identified potential areas of efficacy for pharmacologic agents in the urothelium. So there's a lot going on now, and it's a very exciting time. There's a lot of interest. There's a lot of, at least corporate research dollars being put into this space. We also see similar advances being made in medical instrumentation as it pertains to pelvic floor indications, both diagnostic and therapeutically. So again, we're seeing a true evolution of products and devices that really is very interesting and hopefully will provide our patients with more choices. Functional urology, benign urologic conditions, essentially spans the gamut of pelvic floor conditions in both genders as well as in children. A very important aspect, obviously, is also that group which is ascending from childhood to adulthood, the transitional group as well. It also obviously covers the world of neurourology, which is a very important aspect of our practices and our care of patients. Functional urology, when we consider benign urologic conditions, includes those conditions that are largely lumped into the broad categories of bladder outlet obstruction, which can include BPH and other smooth muscle dysfunctions, as well as anatomic dysfunctions of the urethra. Pelvic pain and irritative symptoms consistent with the diagnosis of such things as interstitial cystitis, again, a condition that we still don't fully understand, but one that is continuing to challenge us. Also, stress incontinence in both genders is covered in the area of benign urologic conditions. And finally, pelvic organ prolapse. So those are sort of the basic, if you will, Venn diagrams that we see and treat. Much of what we do in functional urology is symptomatic, again, except in the case of neurourologic dysfunction, where we are concerned about upper tract decompensation and other threats to significant morbidities that could result in mortality. Most of what we deal with are symptomatic conditions that are extremely bothersome and disruptive to our patients' quality of life, and obviously we are focused on assessing the baseline severity of their symptoms, both subjectively subjectively and when we can objectively. And then providing a course of therapy that allows us to hopefully change the bother that these individuals are experiencing from whatever condition they develop, and then measuring that again with whatever objective and subjective items that we can identify from the standpoint of evaluation. One of the things that was been very important, I'm going to speak personally to me about my entry into functional urology was mentorship, and this is a topic that Carl Eric and I have talked about over good glasses of wines for the last 2 decades, and the importance of having intermediate and senior levels of practitioners who take an interest in the younger generation, both at the training level, but also in the early professional career once you've graduated from training. And we use a lot of terms for that, but mentorship is a good term for that. It's good to have a person that you can to rely on and seek counsel from when necessary, and who you can confidentially get a career advice and assistance from when necessary. That was certainly true for my career. I'm in urology by complete happenstance. I was very interested in doing obstetrics and gynecology in medical school, and did not have a good experience on the medical school rotation. And during my surgical rotation, which was a required rotation, a senior urologist took a liking to me and actually sparked my interest in urology, and then that's launched my career, and so that has left a lasting memory for me of the importance of this interaction between intermediate and senior people and younger people, and the importance it can have for your career. So many societies are establishing mentorship programs for young graduates and trainees. For instance, SUFU, which I'm also a member of, also has 2 separate mentorship programs, and one specifically dedicated to young professional women who are handling the unique hurdles that women must accomplish or overcome during their professional careers. So I think that mentorship is an important aspect of it, and if you don't have it at your institution, please look for and actively seek out someone who will take an interest in you and give you the inspiration to move forward. Again, depending upon your interests, I think we would all tell you that it's very, very important to focus, to find focus in something that you enjoy. So there are lots of conditions that I mentioned that fall into the benign functional pelvic floor conditions, and I must say that I'm not good at all of them. I do treat patients, for instance, with pelvic pain and interstitial cystitis, but that's not a population that I'm as good at, that I feel as comfortable treating as, for instance, stress incontinence and pelvic organ prolapse. So part of your commitment to practice is finding something that you truly enjoy and can persist in and draw internal satisfaction from the practice of medicine. So I highly recommend that you maintain the importance of your own personal intellectual happiness as you move forward in your career. The other thing I always tell people in early practice is it's very important to maintain life balance. You're at sort of a career where you're at a stage in your career where you are in a slope of activity that is very steep. But you must remember your own physical and mental health, and to take the time to do the things that you enjoy doing to allow your brain to rest and your spirits to perhaps flagging spirits to be regained. So those are all sort of little points that I wanted to make to you about the importance of the stage of your life and the considerations that you must have for yourself. What I'll do is we're going to try to make this an interactive session. So there is a microphone. We encourage you to step up. There will no questions shouldn't be asked. We'll have a sequence of lectures, which, as I said, Lori will begin with the first translational lecture. Feel free to interrupt us in the lectures or in between lectures, and we're going to have some time that's built into the schedule because the formal didactic component actually finishes at 15:30, so we have 30 minutes where we can sort of have individual interactions as well then. So we've got a lot of sort of interactive time, and I'd like you to remember that. So Lori, why don't you come up and do your bench to bedside?